Okay, so tonight's session, inshallah, will be the latest format of HO assessment and common reason of extension among housemen. Okay, so this will be two important topics combined together. So we will have a longer session, about 1 hour, or maybe plus if you have a lot of questions. Okay, so feel free to type your question in the comment section. Okay, I will answer along the way. Okay, let's go through our discussion or presentation outline. Okay, so firstly, aim of this presentation is to share with you all what are the current or the latest format of HO assessment per HO logbook by KKM. Okay, and what are the common reasons? So by knowing the format of assessment and common reason of extension, hopefully you can plan your revision, you can plan your posting accordingly, and most importantly, you can avoid the common reason of extension. Okay. So the first part of our session will be we will see the macro view first. Okay, big picture of what are your component or tool of assessment. Okay, so kalau macam exam SPM dulu kita ada apa? Ada kata objektif, ada subjektif, ada essay. Okay, so we will see what are your component of assessment. Then what are the timeline of or schedule of the assessment? Mean each component of the assessment must be done within certain period of time. Okay. So you need to know this so that you can plan your posting accordingly. And then last but not least is the format or scoring of your CCP or certificate completion of posting. So as you know nowadays, as houseman, every posting you will get a mark. Okay, so the mark for each posting will be called certificate completion of posting. Okay, over 100%, you will get your percentage lah. Okay, and 6 CCP will make up your CCHT or certificate completion of housemanship training. Okay, so we'll see every compartment or every component of your assessment, what are the weightage in forming the 100% of your CCP. Okay, so after that we will zoom in each component of assessment. So tonight we will be focusing on the compulsory procedures and topic. Okay, and then last but not least will be common reason of extension, and we will end with action plans for you all, what you need to do having known all these assessment format and common reason of extension. Okay, whether you are medical student, medical graduates, or working houseman as well. Okay, so that is the introduction. So welcome again everyone. I see a lot of medical graduates, okay, eager to start housemanship. Hopefully you will be a great help to your seniors who are struggling in the hospital soon. Okay, so let's start. Okay, first is the assessment tools, or what are the structure of your assessment. Okay, quite a busy slides, but basically let's see at this diagram. Your assessment will consist of procedures. Okay, under procedure there will be DOPS, directly observed procedural skill. These are procedures you need to master within your tagging period. So DOPS are usually part of your off-tag assessment. Next is compulsory perform procedure, CPP. So these are compulsory perform procedure, means you need to perform within your 4 months posting. So DOP is compulsory perform during 2 weeks of tagging. Okay, the last part of your procedure is COAP, which means compulsory observe or assist procedure. These are usually more invasive or more complicated procedure which you just need to observe or assist, okay, not necessarily perform it by yourself, okay. This is regarding procedure. Okay, next is regarding your clinical knowledge, okay. You'll be assessed in the form of CBD or case-based discussion. This is equivalent to your long case during medical schools, and mini CEX, which mini clinical evaluation or clinical mini clinical examination, okay, which equivalent to your short case, okay. And then for medicine, you will need to pass your basic life support, but usually most hospital will include BLS during your hospital orientation, so no issue lah, means you already passed the BLS before you start your first posting, okay. And most hospital also have MCQ, which is a written multiple choice questions, okay. And then in terms of your attitude and professionalism, we have what we call multi-source feedback, where you'll be assessed regarding your attitude, your punctuality, your discipline, and how you communicate with others, okay. So basically, these are 5 components or 5 assessment tools, regardless of which posting you are. Basically, you have the same structure. First is your procedure, okay. Next is your clinical knowledge, okay. MCQ or written test, and attitude. So basically, this is the main 4 lah. BLS is additional for medicine, okay. Okay, so that is your component or assessment tools. Next, we will see what are the deadline or schedule in which you need to pass at each component, okay. So, okay, this is taken from medicine logbook for houseman, okay. So, let's focus here. This is your tool which we discuss or we go through together just now. And next to it is the time frame in which you should pass or attempt the assessment, okay. Okay, so let's see. Okay, DOPS directly observe procedural skills. 5 means you have 5 DOPS. We'll see the list of procedure for medicine a little bit later, okay. So as we discussed before, the time frame is within first 2 weeks, okay. Means within first 2 weeks, you need to be able to perform this procedure competently and safe, okay. Okay, next is your compulsory perform or compulsory observe procedure. So within 12 weeks, 12 weeks mean 3 months. Why 3 months? Because usually towards the end of 3 months, you will need to submit your logbook, okay. So next is your CBD. For medicine, what KKM propose is 1 case-based discussion and 1 mini CX throughout the 4 months posting, okay. So if you have 1 case-based discussion in your posting, you should attempt within the first 8 weeks, okay. First 8 weeks means the first 2 months you should attempt. Why they suggest you to attempt early is, if fail, you can repeat within 12 weeks. So if you fail, you will have another 1 month or during your 3rd month to repeat this assessment, and maximum attempt is 3 times before you'll be extended if you couldn't pass within these 3 maximum attempt, okay. And same goes to mini CX, okay. You should try or attempt within first 8 weeks. If fail, you can repeat during your 3rd month, okay. And maximum number of attempt is 3 times, okay. So BLS and MCQ. BLS will be covered during the hospital orientation. So MCQ will be offered once a month or according to your department, okay, based on your department, Okay, and then multi-source feedback or your MSF. This is your attitude and professionalism. Okay, so if no major concern, okay, we'll see what are the list of major concern. Okay, and incident of concern. Okay, so take note that there's quite a number of assessment tools which you need to follow and attempt accordingly to the time stated in your logbook. Okay, so this is a quite simple table when you have only one CBD and one CEX. But take note that some department, okay, might have more than one CBD and mini CX. Okay, some department might have require you to pass 2 CBD or 2 CX. I've heard a department with 4 CBD and 4 CX. Okay, so you need to know additional requirement by your department and you need to plan accordingly. Okay, so if you have more CBD and mini CX means your timeline will be much tight lah. Okay. Okay, so next is the weightage or the marking of your assessment tools. Okay, basically what makes the 100% of your certificate completion of posting. This is taken again from a medicine logbook for houseman. Okay, so if you can see the total mark is 100%, okay, what you want to achieve, we are aiming for excellent mark, okay, which is 90%, and that bringing a grade of 4, okay, to your CCHT. Okay, so CCP is certificate of completion of your posting is for specific department. Each department, all the 6 CCP will be accumulated, or the average will make up of your CCHT, or certificate completion of housemanship training. Okay, so the excellent mark is more than 90%, okay, which bring you the grade of 4. Okay, so what do you think? Senang ke susah nak dapat 90% ni? Okay, so actually I will show you that it is not that hard to score, and a lot of the components are what we call free mark. Okay, so let's see what makes up the 100%. Okay, 15% is by your attendance. Okay, attendance means whether you present during your shift. Okay, Faris Zahri, it's not that difficult to score 90%. A lot of medical alumni easily because they plan their posting properly. Getting 90% is not it's not impossible. It's really doable provided you prepare yourself well for the posting. Okay, and you plan properly. Okay, plan properly means you observe the deadline properly. Okay, so let's see. The first free marks, what I call free marks, because you can score full in this part. Okay, first is attendance. If you attend means setiap kali kerja you tak pernah MIA lah basically. Okay, every time you're supposed to come to work, you are there. Okay, and also attendance to your CME. Okay, continuous medical education. Usually each department will have one CME or teaching session dedicated for housemen, so make sure you attend that regardless you are pre-night or on call ataupun, means although the teaching session is not during your working session, you need to make some effort to attend that session lah. Okay, so another free mark, okay, 15% is your LNPT. Okay, so LNPT is basically your sasaran kerja tahunan, but nowadays housemen have to fill in the SKT every posting. Okay, so there will be a template of how to fill in SKT. In most department it is online, so make sure you submit it properly and before the deadline so that you can score So 100% from your LNPT will be converted into 15% in your CCP. Okay. Okay, so yang atas ni free mark. Datang kerja hari-hari or when you're supposed to come, never miss your CME. Okay, there's a good question from Ainul Nabilah Asri. Any type to attend CME in case it happens during our working time and not off day? So kalau CME tu during your working time and not off day, by right you have a dedicated or protected time to come to CME. So usually your MOs, so teaching houseman usually petang lah pukul 3 macam tu. Usually we will settle, all the housemen will try to settle the PM round and settle your post round order, and usually MO will cover your ward for the 1 hour session so that all housemen can attend the teaching. That is the usual practice lah. Okay. Okay, so no issue. The issue is when the teaching is not on your working day. Okay, mean you're working night that day and you have teaching at 3 to 4, so you need to come despite it is not your working hours lah or working shift. Okay. Okay. Okay, next we will see the apa ni? The free mark first. Okay. And then okay, so this is your CMA attendance. So the first part is your attendance to work. Okay. CMA attendance. Fifth, if your okay, end of posting. Yang ni kena study lah. Usually it comes in term of MCQ. Okay, which make up your 25%. Okay, so if it is an MCQ, you can ask from your senior houseman who has passed the department whether they have a bank of questions so that you can study them much earlier. Okay, so you will need to work on this 25%. Okay, so 40% here, the largest component of your assessment. 5 mark come from your multi-source feedback. Basically, if you are good houseman, you have a good attitude, you can work properly with your team, you are accessible, means during your working hours, whenever people try to call you, you're accessible lah. Okay, and you communicate professionally. So this is also 5 mark because I believe all of you are bagus lah, excellent. Okay, so what makes up the 35%? Okay, so usually let's assume that this department have 1 case-based discussion and 1 mini CX. So from this 35%, 5% will be given if you submit the logbook on time. Okay, so 5 is another extra mark provided you submit your logbook on time. Okay, so another 30%, okay, is 15 for your CBD and another 15 mark for your mini CX. You will score 15 full if you pass at first attempt. Okay, and same for mini CX lah. Okay, so let's recap which part you can score without much effort. Attendance, come to work on time and when you're supposed to come. Okay, LNPT, fill in your LNPT on time and according to the format that is being given to you. Okay, submit your logbook on time. Okay, and be a good and professional houseman. And come to all your CME. Okay, means you can get 30% here, 10% here, 40, 45, or almost half of the mark is free mark actually. The one you need to work on, which you need to study, is your end of posting. That is your MCQ here, which make up the 25%, and another 30% for your CBD and mini CX. Okay, so usually CBD and mini CX, the grading is A, B, and C. A and B is considered pass. So if you pass at first attempt, you will be granted full 15 marks for each. Okay. So having know that, you need to plan your posting accordingly. Okay. So if especially if you have more than one CBD and more than one mini CX. Okay. For example, if you have mini CX and 4 CBD, means you have to attempt once every month. Okay. So you need to plan accordingly lah. By plan means you need to set aside a proper time to study. Okay, and you need to approach or book your assessment session with your supervisor or specialist. And that's it. Yes, study, approach specialist, and make sure you can do the assessment before the deadline. Okay. Okay, if no question, I will proceed to the next part. Okay. Okay, this is an example before we go to the compulsory procedure and topics. Okay, this is for pediatrics. Okay. So for pediatric, minimum number of assessment is 2. Okay, so you will need usually 2 CBD and 2 mini CX. So this will be the rough timeline. Okay, so within the first 2 months, you will pass your mini CX and or CBD, and your logbook will be reviewed at this time. Okay, and another mini CX and CBD in your 3rd and 4th month, and again your book will be reviewed, your logbook will be reviewed. Okay, so previously neonatal resuscitation program, which equivalent to BLS in adults, so in units is NRP, is compulsory for all housemen during pediatric posting. But nowadays, because there's a lot of housemen, most sebab pun couldn't cater that. Okay, so but it's good to know, and you need to have a skill of how to resuscitate newborn. Okay, so even though it is not a compulsory requirement for you to pass your posting, I would highly recommend you to study the NRP book and have some practice of the practical part, which we call mega code, so that you can practice how to resuscitate newborn during your pediatric posting. Okay. Okay, now let's focus on compulsory procedures and topics. Okay, are you guys okay? Kalau ada soalan, tanya dekat komen Okay, so for this part, compulsory procedures and topic, I will focus on medicine and pediatric only. Okay, so for other department like surgery, orthopedic, and ONG, you can download the logbook in KKM website. Simply Google HO logbook KKM. Okay, then you can download or view the logbook. Okay, or you can learn in pre-HO essential online course by Medicom. Okay, so next. Okay, regarding procedure, before we go to the list of procedure that you need to know, okay, so again, we have DOPS, directly observed procedural skill. Why we call it DOPS? Because before you attack, somebody will need to directly observe you do this procedure and ensure that you can do this procedure correctly. Okay, so kalau dah lepas TOPS tu, usually then only you can off-tag lah. That is part of your off-tag assessment. Okay, and then CPP is again compulsory perform procedure, list of procedure which you need to perform during 4 months of posting, and compulsory observe or assist procedure that you need to observe or assist within your 4 months of posting. Okay, so what you need to know about each procedure, which we will discuss later. Okay, basically 4 things. Okay, and these are the 4 things which we emphasize during clinical skills workshop by Medicom. First, you need to know what are the indication of this. procedure when you need to do this procedure. Second, what is contraindication? Okay, despite you have indication, reason to do, but in certain situation you cannot do this procedure. Next is step by step how to perform the procedures. Okay, and last but not least, what are the common complications that might arise from the procedure that you are doing, and how you can detect and manage accordingly this complication. Okay, and last but not least is how to document the procedure in BHD or patient file if you are in non-computerized hospital, or in the case note if you are doing your housemanship in computerized hospital. Okay, remember indication, contraindication, step by step how to perform the procedure, and common complication. Okay, so this is list of procedure for medicine. Okay, so medicine clearly I differentiate which procedure you need to master within the first 2 weeks. So directly observe procedural skill. So first 2 weeks of posting. Okay, so these are basic one. Actually, DOPS are quite similar to all posting. Okay. Venipuncture means blood taking. Venous blood taking. IV cannula or branula insertion. Blood culture procedure means sterile venipuncture technique. Arterial blood gas sampling, so ABG. Insertion of urinary catheter and insertion of rice tube. Okay, so these 6 procedure is compulsory or DOPS in medicine and in all other posting. Surgery, ONG, apa ni? PITS and ortho as well. Okay. But in other posting, for example, ONG, apart from this basic procedure, they will have additional DOPS. For example, how to conduct delivery, okay, how to do amniotomy. So they have additional compulsory procedure which you need to master during tagging. Okay, so these are the basic one which you need to be able to perform independently, because after tag you will be in charge to certain ward. Okay, independently lah, mungkin you jaga satu ward seorang kan, bila you punya night shift, so you need to do this, be able to do this basic procedure by your own. Okay, so next group is compulsory perform procedures. Non-DOPS mean you can learn or master it within the 4 months of posting. So performing ECG and interpret it correctly. You need to know what are the indication of ECG and how to interpret correctly. Okay, and satisfactory discharge summary. Okay, and then the last part is compulsory observe or assist procedure. These are more complicated and more invasive procedure. Usually will be done by your medical officer, so you will need to observe or assist. But if you know the indication, you know the contraindication, you know how to do it step by step, and you know what are the common complication that might arise, okay, you can do this procedure under direct supervision of your medical officer. Okay, so okay, this is for medicine. Okay, and this is for pediatric. Pediatric also clearly delineate your DOP. So again, this is your blood taking for neonates and pediatric. Branula incision for neonates and pediatric, blood culture and delivery of bronchodilator. Okay, ada compulsory perform procedure which you need to know within the 4 months of posting is your NRP. Okay, again rice tube. Okay, number 9. Okay, heel prick or dextrostick, ECG record and interpretation, oxygen therapy, okay, nebulization, and more invasive or technically difficult, more difficult procedure is your compulsory observe or assist. This is umbilical cord catheterization, lumbar puncture, blood exchange transfusion for severe NNJ, chest tube, intraosseous line, bladder catheterization, and ABG because it is technically more difficult in pediatric patient. Usually this need to be done by MO or by houseman but under direct supervision by medical officer. Okay. Turka Devi asks, got any example or writing discharge summary? Okay, if you download the medicine logbook, there will be part on how to do discharge summary or criteria for good discharge summary. Okay, but if you want to practice, susah lah nak practice sebab belum masuk houseman kan. But you can see some example in our advanced Medicorp pre-HO online course. Okay, so in advanced pre-HO online, we teach and practice how you do basic documentation as houseman, means how to do review, how to clerk, how to prescribe medication, how to do discharge summary, and how to do request and referral as well. Okay, so there will be some example which you can try and we will give answer in online advanced pre-HO course. Okay. Okay, if no other questions, let's proceed to the compulsory topics. Okay, so we are done with compulsory procedures. Okay, so for other posting, you can download the logbook. Okay, so this is our clinical skills workshop. It's a 1-day event. Okay, we do it in small group session which we will learn 10 procedure. 10 procedure. You will practice all these 10 procedure. Basically, this 10 procedure is DOPS in all posting. Okay, so we'll cover CPR, okay, chest compression, nasogastric tube insertion, venous blood taking, IV line, urinary catheterization, how to conduct delivery, and delivery of placenta. Okay, and another 4 is additional 4 demonstration. We will demonstrate to you blood culture, ABG, what else? Amniotomy and parectal examination. So all are very common and compulsory procedure for you. So if you are going to start your housemanship, you are expecting next intake, it is very recommended for you to join so that you can practice or brush up the skills before you start taking. Okay, so there's a few questions. Nazihah tanya, logbook download daripada website KKM ke? Adakah semua hospital guna logbook yang sama? Yes, semua hospital pakai logbook yang sama. Okay. Cuma ada sesetengah hospital dia akan bagi printed version to you. Some hospital will ask you to download and print by yourself. So basically semua hospital pakai logbook yang sama. Cuma setiap department mungkin ada additional requirement to OFTAC. Okay, macam saya bagi tahu tadi, kalau medicine, KKM recommend 1 case-based discussion and 1 mini CX sahaja. Kalau pediatric, they recommend 2 CBD and 2 mini CX. But your department might want to do more. Okay, diorang nak mungkin buat lebih banyak assessment lah. Okay. Another good question by Jun Hang Lee. Doctor, do we need to purposely seek the opportunity for CPP, compulsory perform procedure, or we should be able to do it during our routine work? If there is any, can you provide us example of procedure that we would rarely meet during our work? Okay, basically, if you see, okay, let's see, all these compulsory perform procedure, you will encounter it every day in your ward. Okay, so there is a lot of opportunity and usually this compulsory perform procedure memang houseman punya job scope. Okay, but what you need to catch or what you need to be more proactive is compulsory observed or assisted procedure, because this is quite rare, not as frequent as the compulsory perform. And for pediatric, this is usually done in pediatric ICU, okay? So, or an ICU neonatal intensive care unit, okay? Blood exchange transfusion, we don't do it, or you don't encounter it in daily basis lah, okay? Okay, and for medicine, all these adopts and CPP, you will have opportunity to perform it or encounter it every day in any medical ward. But for the COAP, this is usually more offensive, and you don't encounter it on daily basis lah. But I think at least every week you will have this procedure lah, lumbar puncture, CPR, long line insertion, central line insertion, okay? So usually what housemen do is they will shout out in their working WhatsApp group. So ada long line insertion. So those who are free can come and observe that procedure. So by doing that, you have the opportunity to complete your logbook lah. Okay. Okay. Husni, does medical offer online clinical skills workshop? We have the videos, but since it is practical skills, so we will need to attend it physically lah at our skills lab at Selayang. And Tafiz has shared the logbook in pre-HO telegram group. Okay, thank you Tafiz. Okay, so let's continue. Okay, so before we move forward to procedure, if you download the logbook later, go through each page, and you will notice that for all the DOPS or directly observed procedural skill, okay, we will have the marking sheet. Okay, it's like your OSCE lah. Okay, what are the steps that you will need to follow when you perform this procedure? So I put here insertion of urinary catheter. Okay, so basically housemen need to know the clear indication. So you must perform it under aseptic technique and step by step. Okay, so these are the steps that medical follow when we do the clinical skills workshop. Okay, so we have another good question by Ain Najiha. Is there minimum requirement for COAP that we must observe, or all of it is compulsory? Okay, so let's go back and see. So if you see here, all the CPP and COAP, you will have 5. So minimum, you will need to do 5, or you will need to observe 5. Okay. You can see there will be tables in the logbook which mention how many times you need to observe or do each procedures. Okay. Okay, so if no further question about the procedure, let's move forward to compulsory topics or HO curriculum. Okay, so before we go through the list of topics, you need to know what you need to know about each diseases. Okay, first is you need to, and this is also the format of your case-based discussion assessment, in which your supervisor or your specialist will assess you whether you can first establish the diagnosis. So what are the things you need to ask patient during history taking? What question you need to ask during review to assess progress of patients? Okay. And what are the risk factor for that particular diseases. Okay, and next is on physical examination, what are the signs to look for and you need to detect during physical examination, and subsequently what investigation you need to order to confirm and exclude other differential diagnosis. Okay, so basically these are what you are been doing day in and day out in the ward. Okay, they just want to know whether you really capture the knowledge. Okay, so first you need to know how to establish diagnosis. So what to ask during clerking, what signs to look for during physical examination, and what investigation to order. And when you order certain investigation, obviously you need to know the indication of that investigation, what are the normal value and what is the significant from the result. Okay, next is how to manage. Okay, so how to manage. Okay, in terms of management, okay, I think there's a lot of confusion about this. What we expect from houseman about management? Okay, when you are a fresh houseman, means you are coming to tech in a new department. What we expect from you is first you need to understand principle of management. Okay, for example, what is principle of management? For example, dengue patient, principle of management is IV drips. Okay, monitoring of vital signs, monitoring of investigation. Okay, so these are principle of management. Okay, and along the way you will need to know step by step management. Okay, step by step management is how much drips you want to give. Okay, how frequent you need to monitor the vital signs. Okay, how frequent you need to repeat the blood investigation. Okay, so these are principle of management and step-by-step management. Okay, don't worry too much regarding management. Usually template of management for all common diseases are readily available in your posting, or usually we will have department guideline, or your senior houseman usually have template of management for each common posting, which you can learn during your tagging period. So it's okay. You don't have to have macam apa ni notes on all the important management. Okay, because management is something that you should be able to formulate from condition of your patient. Okay, based on patient diagnosis and patient condition, you need to be able to formulate your own plan of management. Okay, so plan of management ni kita belajar untuk faham and kita formulate sendiri. You cannot simply copy management from certain notes or something else. Okay, and you cannot simply copy one patient to another patient. Okay, because you need to individualize or accordingly change or individualize the management. Okay, so in advanced pre-HO, I teach, I share how to formulate the management, according to Venom's formula. This is first ventilation, whether you need to think whether this patient need oxygenation or as any assistance in the ventilation. Next is what do this patient need to take orally, or you need to give IV drip. If IV drip, how much and what is the right solution for your patient. Next is monitoring. So basically what you need to monitor in your patient. Next is medication. What medication you need to prescribe and you can prescribe as houseman. And last but not least is your special order. This is your investigation, your procedure, your referral, request, and TCA or appointment upon discharge. Okay, so again, kalau you medical graduates, during a waiting time, what you need to know is principle of management. When you start working, you need to be able to formulate your own management, okay, based on your A, B, C, D, E format, or airway, breathing, circulation, okay, drugs, or you can use venoms, which is more suited to more stable patient lah. So we use ABCD, usually in critically ill or patient or during resuscitation. Venoms formula is more tailored to patient yang more stable in your ward lah. Okay. And last but not least is how to document all this finding in BHT and case note. Okay, so clear what you need to know. Establish diagnosis, how to manage in terms of management, principle of management, and step-by-step management. Okay, so let's go and see. Don't be shocked with this slide. Okay, this is taken from your medicine logbook on the mandatory topics. Okay, so again, they emphasize that housemen need to know knowledge in prevention, diagnosis, management, and rehabilitation of the condition. So, Bong Ping Das, doctor, basically it sounds like student style. Yes, you're doing the same thing, but usually they will focus in your assessment. If you pass the diagnosis part, they will dwell more into the management part. Okay. And when you are a houseman, you need to be specific with your management. For example, you cannot simply say the treatment is antibiotic. You need to mention which antibiotic you want to use, what are the dose and the duration of the antibiotics. Okay. Same goes if it's about diabetic emergency. Okay, so you need to know exactly what type of oral anti-diabetic agent, what are the dose, okay, what are the side effects, okay, what are the common adverse effect from that medication. So you need to be specific. Basically, it is almost the same like your professional exam, your long case and your short case. Okay. Okay, so why 16 topic? Okay, it's actually more than 16 kan, sebab kalau you tengok dengue and other common infection, leptospira, cholera, malaria. Okay, so why 16? Because you will spend 4 months in each posting, and basically you will have 16 weeks lah. 4 months times 4 weeks, so you will have 16 weeks. These all topics will be covered during your weekly CME. So basically housemen will take turns to present this topic. Okay, so you will present to all your houseman colleague, and usually there will be one specialist to oversee the teaching session. Okay, and if you see, attendance must be a minimum 12 out of 16 session. Okay, baru you boleh means you fulfill the requirement to pass from that department lah. Okay, but my advice is, knowing that you might be assessed in your case-based discussion or mini clinical evaluation from this 16 topics. So your CBD and mini CX must be from these 16 topics. So attending your weekly CME is a golden opportunity to learn it from someone else. So you don't really have to kena buka buku jugalah, but at least it will be much easier if you have somebody to explain it to you, and you will have your specialist readily available during the teaching session to answer your questions. Okay. Again, your houseman CME is usually protected time for houseman. Okay, so you'll be relieved for 1 or 1.5 hour from work so that you can focus on the teaching session. Okay, so let's go through quickly. This is dengue, sepsis, and rational use of antibiotic, TB, tuberculosis, diabetes and their emergency, hypertension and their emergency, okay, acute chest pain, heart failure, ECG, acute breathlessness, approach to common respiratory diseases, asthma and COPD, acute confusion, fluid and electrolyte disorder, acute kidney injury and chronic kidney injury, different type of shock and communication. Okay. So, okay, there's a question from Ibn Mursal. What's the best reference for the specific management in practical setting? Okay, those topics which have dedicated CPG or clinical practice guideline, you should go through or follow the clinical practice guideline. So basically, dengue have its own CPG, sepsis or rational. We have the national antibiotic guideline. TB, diabetes, hypertension, acute chest pain, we have three different CPG. You will have STEMI, unstable coronary artery disease, and non-STEMI. Okay. Heart failure, we have CPG. Okay. Bronchial asthma, you should follow GINA. COPD, you should follow GOLD. And yes, so basically the top 10, you have a proper or designated CPG from Academy of Medicine. So boleh pergi dekat Academy of Medicine Malaysia and download the CPG. If it's too much for you, you can first go through the quick reference or QR. And I would recommend this book from Medicorp. CPG Made Easy. So basically this is simplified version of our CPG. It is recommended for medical graduates and housemen, but when you treat your own patient in the department and for the purpose of your end of posting assessment, you still need to refer to the full CPG. But this book will be helpful to assist your initial reading or preliminary reading, so that it will be much easier for you to understand the full CPG. Sebab satu CPG tu beratus-ratus muka kan. Okay. 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 Another question from Sukumaran Vinoshin. Any advice on what are the key points for the presentation? Do we focus on theoretical or we just focus on management when you study? So you focus both lah. You focus usually in terms of presentation, you will need to cover from the classification, how to achieve diagnosis, what are the symptoms, signs, investigation result, and management, as we have discussed earlier, principle of management and specific management. Okay. Untuk kalau presentation waktu houseman, you need to be specific in terms of the management, but for the purpose of your revision during waiting time before housemanship, it's okay to just understand the principle of management. Okay, sebab ubat mana, dose apa semua tu, it's quite impossible for you to remember because you are not dealing with that drugs day in and day out. Okay. So for purpose of presentation, you need to follow the format that I've mentioned. Another tip is you can ask any senior houseman who has presented the same topic before, and if you're still blur, usually there will be a dedicated MO or specialist who in charge of the houseman CME, and then you can ask what you should cover in your presentation. Okay. Okay, so Gang Neswari asked how to get Medicorp book. You can go to medicorp.store. Okay, our postage is every Tuesday and Thursday. Okay, so let's go to, surprise, we haven't finished with medicine. Okay, first it is compulsory or mandatory topics which will be covered during your weekly CME session, but you will also have other essential topic which might not be covered during your weekly CME, but you will still need to know. These are quite common as well. So approach to cardiovascular risk factor, stroke, seizure and epilepsy, DVT, anemia, cytopenia, HIV, GI bleed, approach to jaundice, and some endocrine, skin, geriatric, poisoning. So basically, there's a lot to learn, guys. So if don't feel overwhelmed, at least you cover the common ones, the first 10, okay? And I'm working with my team to make a list of compulsory topic which we arrange in a manner that the most common one come first, so you can prioritize which topic to cover during your waiting time, okay? And we'll include a common medication list as well. Okay, so these are your mandatory topics, okay? But for the purpose of your case-based discussion and mini CX, they usually will take from these 16 mandatory topics, okay? Which are more common and more commonly accounted lah. Okay, so no excuse for you not to know these topics. Okay, so take a deep breath and let's go through pediatric. Okay, Bong Peng Daas will be managing COVID patient when we start. Basically no, because COVID patient will be isolated in their own COVID ward or COVID ICU. So usually nowadays the managing team is medical officer and specialist, but recently there have been a directive from KKM to offer to senior housemen, means 5th or 6th poster, who are excellent and interested in joining the management team. Okay, so if you are offered, you might want to join the COVID team, but not when you start lah. Okay, it's only open to 5th or 6th poster. Okay, let's continue to compulsory topic in pediatrics. Okay. Okay, so again, you will have the mandatory topics. So one topic per week for your CME or teaching session. So you have 16. Okay, so if you see this note down here, all emergency aspects should be thoroughly covered. So must attend 75% or 12 out of the 16 CME topics. But take note, some department require you to attend all the 16. Okay, so there's quite a few of hospital or pediatric department which I know they require the houseman to attend all the 16 teaching session, means you cannot miss any teaching session in order for you to pass the department. But it is a good practice to ensure the houseman really learn all these compulsory topics. Okay, and other essential topic which should be covered at bedside teaching. Okay, because it is not covered in the formal teaching. Okay, so which it's quite a lot, right? Okay, so for pediatric, your reference will be much easier. It's your pediatric protocol. Okay, you can download the PDF version, but I strongly recommend you to have the physical book so that you can jot down notes. Okay, and you can mark which part you have learned and go through, and it will be much easier for you to refer to when you start working later. Okay, so let's go. What are the topics you should focus on? Means from these 16 topics, what are the most common? And these common diseases are usually part of your off-tech assessment, because it is so common. When you start to work, you directly will deal with this kind of patient. So you need to know it in and out lah. Okay, so first is neonatal jaundice. It's compulsory to know. Second is respiratory distress of the newborn. Okay, what causes respiratory distress in newborn? So this is congenital pneumonia, mechanical aspiration syndrome. Okay, prematurity and neonatal hypoglycemia, CNS emergency in children, febrile fit, meningitis. Okay, what more common? Pediatric emergency, shock and respiratory failure. AGE, this is very common. Usually you will have a designated or a specific ward for AGE. And you will deal a lot with fluids and electrolytes management. Next is your bronchial asthma and acute respiratory infection. Last but not least is dengue. So there is 8 or 9 topics which you should focus for your revision before starting housemanship, and these are all your off-tech assessment questions. Okay, so this is also the topics which Medicorp will cover in our upcoming pediatric online course, which will start end of February. Okay, so we choose out of these 16 mandatory topics the most common one, so we'll cover at least half of it so that you are ready to tagging and work independently. Okay, so the rest of the topics are less commonly encountered, so hopefully during the posting you can take your time and learn this topic. So these 9 topics are the one you should focus on during your waiting time. Okay, and what additional topic which Medicorp will cover in our pediatric online crash course is interpretation of ABG, because it is slightly different in neonates. Okay, because we are using capillary blood gas, not arterial blood gas. Okay, basic diagnostic imaging investigation. Again, the normal value for pediatric patient is different from adult. Okay, so we need to discuss that. And also medication as well, because all the dosage need to be calculated according to patient's weight or body surface area. Okay. Okay. Are we good? Are we good? Thank you for staying up till this point. Okay, if there's no other questions, let's see the common reason of extension. Okay, so you need to know this so that you can avoid them. Okay, and plan your posting properly. Okay, so this is again taken from Medicine Logbook by KKM. Indication for extension is first, fail case-based discussion or mini CX after third attempt, provided you attempt within the designated deadline lah. Okay, so what they recommend is the first 2 months you should attempt your mini CX or CBD, so that you can do the 2 attempt in the rest of 2 months. Okay, so what happened to most housemen is they delay their first attempt. Okay, so a 3rd month or 4th month, few weeks before finish their posting, baru dia approach specialist. Bila you approach specialist lambat, if you, first you need to understand that your specialist will not be assessing only you. They will need to assess a lot of housemen. So mungkin kalau you approach specialist, okay boss, I dah nak habis next week, boleh tak nak arrange assessment? So satu, obviously your specialist is busy, especially during the pandemics. So if the specialist happen to have another 4 housemen who has approached him first before you, so obviously you'll be extended even before attempting the first attempt. So this is what I call auto extension. So please, you need to plan your posting. Okay, means you need to approach your specialist early, and obviously you need to study even more earlier before you approach your specialist. Okay, so that in case you fail, you will still have opportunity to do second and third attempt without being extended. Okay, but hopefully you pass at first attempt lah. Okay. Okay. So I know Nabi asked talking about extension, how can we check on the rate of extension in all hospital in Malaysia? I don't think we have some such data. Okay, so basically the reason of extension are more or less the same. Okay, so we'll go through this table. Okay, so second reason is again fail MCQ at 12 weeks. So means after third attempt, you'll be extended. Okay, the third one is quite famous as well. This is another reason of auto extension which you should avoid at all costs. Does not complete the law of compulsory procedures. As we have mentioned earlier, all these compulsory procedures you can find it day in and day out. Okay, and you will do it a lot even during your tagging. So please make an effort to fill in your logbook much earlier. Waktu tagging dah boleh start fill in your logbook. Okay, and along the way bring the logbook every day with you so that you can fill in the logbook along the way. Okay. So Sakina asks, will it affect the marks if we fail on first attempt? Obviously, it will affect the mark, but at least you are not extended, okay? Because you still try it during the 4 months posting, okay? Usually, it's very usually specialists are not that macam kejam sangat lah or not really strict, okay? As long as you know how to diagnose and you know the principle of management and you can identify whether the patient is unstable condition, usually you will pass your assessment, okay? But as usual, some supervisor or specialists are more strict than others. So what you can do is, okay, this is important tips, okay? When you report duty to your department, you will know who is your supervisor. You will know from day one who will be assessing you at the end of your posting, okay? So it is very important first to make good impression to your supervisor. Secondly, you need to ask around what are the style of your supervisor, what are the common or favorite questions of your supervisor. Especially you can ask from the senior houseman who has passed their assessment with the same supervisor. Okay, so usually they have for example, if she's infectious disease physician, so logically or their favorite question will be dengue or COVID, okay? So you will have a lot of time to study or prepare for your assessment, okay? But you need to plan properly lah and you need to start asking around, you need to start study much earlier, okay? Okay, Mandip asks, does the failure in each attempt affect the total mark score? I think so, yes. Okay, but if you notice, your CBD only carry 15 out of the 100%. Okay, if you have one CBD, if you have two CBD, so you have 7.5. So it doesn't really affect much. Okay, and you can still work on other part of the assessment, okay, as we discussed earlier. Okay. So don't worry too much. Usually what most housemen did wrong is they are too afraid to approach their specialist for assessment. So when you delay to approach your specialist, so you delay your study, and eventually that will cause more problem lah. Okay. So let's get back to our slide. 4 is report of major concern in attitude. So this is usually what we call incident of concern. Usually it is pertaining if you are involved in blood transfusion error on your miss, usually that will mean extension, compulsory extension. But don't worry, we will have a designated proper session on blood transfusion during your hospital orientation. So be extra careful regarding blood transfusion. And usually a major concern if the houseman did some mistake or negligence which caused directly to morbidity or mortality of a certain patient. For example, if this houseman were told or were informed that patient is in unstable condition, for example, patient is having strong contraction in ONG, patient is having chest pain, but this houseman did not attend and assess the patient or simply give order without attending the patient, usually these are the major concern or incident of concern. Okay. Fifth is another famous and frequently encountered reason of extension, taken leave in excess. So your posting is 4 months. Usually you are allowed to take 8 or 9 annual leave. Okay. But for houseman, sad to say, usually most department will consider MC as part of the annual leave or the 8 or 9 days of the posting. Okay, so be careful with that. Don't take leave in excess so that you won't be extended. Okay, another question from Kamal Hakim. How do we ensure everyone in the team will get chance to do the procedure without feeling having to compete for the procedure? Okay, for compulsory perform procedure, you don't have to compete because it is so many in your ward. Okay, first. But for compulsory observe or assist, okay, most department will allow you to share patient. For example, for chest tube or renal biopsy, this is quite rare. So most hospital will allow more than one houseman to put it in the logbook. Okay, but very few department do not allow houseman to share the procedure. Okay, that is when it is more difficult for you to complete your logbook. But usually, compulsory perform procedure is readily available in your ward, and most department allow you to share the same procedure or the same patient between a few housemen, provided you really observe or you really assist that procedure. Okay. Okay, next question from Aina Zira. If we need to home quarantine due to disease like COVID, does it consider excess leave? So new circular said no. Okay, you won't be considered taking additional access. So you won't be extended, but you just need to complete your numbers or training days. For example, you should be 4 weeks in medicine. You need to quarantine for 10 days. So you kena sambung, you have to cover the 10 days lah, but you won't be considered extended. Okay. Or you won't be considered taking excess leave. Okay. Okay. Hi doctor, if our supervisor goes on leave and we haven't presented to them yet, are we able to present to another supervisor? Okay. So I think you mean assessment. Okay. So if your assessor on leave, okay, this is why you need to arrange your assessment much earlier. Okay, so usually when you think you're ready for your assessment, either it be mini CX or mini CBD, you will need to book or approach your specialist for your assessment. Okay, so you will both of you will find days that both of you are free. So usually houseman, we will try to arrange our assessment on the day that we are not working. Okay, maybe you are post night or before you're working that night. So basically the day is you are not working during the day, and you need to book your specialist for the time that they are free lah, and they are not on leave. Okay, that's why it is important for you to arrange your assessment much earlier lah. Okay, in case your specialists are on long leave or went to certain attachment, usually they will ask somebody else to replace their duty lah. Okay. Okay, so let's go through. So be careful. This is okay. Number 3 and number 5 is what I call auto extension. Mean houseman cause the extension themselves by first not completing the logbook and second take leave in excess. So be careful with these two. Okay. Okay, so another good question by Nadine Mir. You mentioned about CCT earlier. Will it affect our placement for more position in the future, whether we are contract or permanent doctor? Yes. The reason the CCP and CCHT was introduced was to differentiate or to come with an objective assessment of which housemen perform and which do not perform, and that should help with the selection of permanent MOs. But because of lack of permanent posts, nowadays they prioritize those who are with good SKT. So usually those who perform in their sasaran kerja tahunan are those who perform in their CCHT as well. Okay. And those who are willing to serve Sarawak. Okay. So that is the current criteria lah. But yes, it is your apa ni, you will have more weightage to be absorbed as permanent if your CCHT is much better and you are not extended in any posting. Okay, so let's see what pediatric logbook says about criteria of extension. Reason of extension is competence or performance, fail and of posting, procedural skill competence, and performance not achieved as required in logbook means you didn't complete your logbook. Okay, sama kan? Poor attitude, any incident causing concern, okay? Taken leave in excess, so sama. Duration of extension depending on the reason lah. Usually it is 2 months for poor performance and competence. So 2 months for you to pass your assessment, CBD or mini CX. So failure to complete compulsory procedure, you'll be extended until you complete your logbook. Okay, so basically it's the same in almost all posting lah. But certain department have other common reason of extension. So you need to know when before you come into the department, so that you can avoid those reason of extension. Okay, so let's see. This is an unofficial survey in different WhatsApp group of working housemen lah. Okay, so I asked what are the common reason of extension. So not surprisingly, logbook issue or procedure issue means if you couldn't submit your logbook on time, or you couldn't complete the compulsory or required procedure. Okay, so please again fill in your logbook much earlier lah. Okay. Okay, next. Difficulty of getting procedure due to scarcity of certain procedure, or a lot of people wanting to do the said procedure, or clinically not competent enough to do the said procedure. Okay, so how to overcome this? So you might need to work harder in term of getting the procedure. Okay, I think this is those hospital who do not allow their housemen to share the same procedure or same patient in for that particular procedure lah. Okay, but usually most hospital allow you to share patient. Okay, again, blood bank transfusion error near miss usually means compulsory extension. Okay. Fail viva, approach assessor late. Okay, so you didn't get to finish your assessment during the designated time. Late logbook submission and near miss. Near miss means near miss of blood transfusion error lah. So basically, usually extension because you do harm to patient, okay, either by not doing something or by not attending patient, okay, or you do some mistakes, okay. So it is very important to be safe. If you are not sure, please ask, okay. If you don't know, please ask around, okay. And not discipline on your CME or assessment means you didn't attend the required number of CME attendance or fail exam with specialist. So again, be ready, study early, ask questions, survey what are the favorite questions or common question that will be asked during your off-tech assessment and also your end of posting assessment. Okay, you need to know what is your supervisor's style. Okay, and again, common mistake is not approaching your assessor. Don't be afraid of failing the CPD. Most specialists will give you a second chance. Okay, and you need to know, during housemanship, apart from this formal assessment, we assess you day in, day out. Every time you work, how you do rounds, how your attitude while working. So that will kind of help your formal assessment as well. If the specialist know that you are reliable houseman, you can present your case. Okay. So usually they won't be so strict lah. They just want to make sure that you know how to diagnose any principle of management, and you know how to identify and manage unstable patient. Okay, um so we will end with the action plan. So basically I have covered, so if you are a medical student, now you know that your assessment is more or less likely the same as your final professional exam, your short case and your long case. Okay, but we will dwell more details on the management lah when you become a houseman. Okay, so for medical graduates awaiting houseman posting. Okay, so what you can do now is download the logbook, print it, and make the compulsory the list of procedure as your checklist to study. Okay, and when you study, do output learning. Do output learning is okay, let's have like 5 minutes of a mock case-based discussion. Okay, the example of how your case-based discussion will be performed as houseman. Okay, first, for the CBD, usually you will choose your own case. Okay, so it is much more easier kan, you yang pilih. You want to be assessed for any particular diagnosis from the 16 mandatory topics. Okay, so it's either you choose the disease that you feel comfortable with, or if your supervisor want to choose any particular diseases, they need to choose the diseases which you have already taken care of. Okay, for example, dia akan tanya, okay, last week you dekat ward mana? Oh, last week I dekat ward dengue. Okay, so you has been in charge to dengue ward for the past 1 week. So let's do your assessment on dengue. Okay, so for long case or case-based discussion, your specialist will ask questions. For example, okay, so how do you suspect the patient is having dengue? Okay, so you need to mention lah. Okay, fever more than 3 days with the probable symptoms. Okay, so what are the warning sign in dengue fever? Okay, what are the significance of the warning sign? Okay, what else? What are the when doing your physical examination, when you're examining dengue patient, what are the things you want to look for? Okay, what is your 5 magic touch in dengue patient? Okay, so what are the investigation you would like to order if you suspect this patient having a dengue? Okay, so you need to mention lah. You want to order FPC. Okay, so if you want to order FPC, what are the parameters you want to look for which will suggest that this patient is having dengue? Okay, so you need to mention lah, I will see the platelet, I will see the leukocyte count. Okay, I will also see the hematocrit and HP. What is the significance of that number you have to mention. So what are the confirmative or diagnostic investigation for dengue. So you need to be able to differentiate the NS1 between IgG and IgM. Okay, so you will need to know, okay, how you manage dengue patient, how do you count the IV drip, okay, are the indication for admission. So basically that's it. If you have been in charge of the dengue ward, there's no excuse for you not to know these questions. Okay, so basically that is your case-based discussion. Okay, so for mini CX, so this is something like your short case. So usually your short case will be you will need to be you will need to perform a full physical examination, and or usually your MO will assess you how to attend a certain unstable patient. Okay, so for example, you are working, you're working on night, you're in charge of 2 wards. Suddenly your staff just mentioned that this particular patient who is having a chest pain. What should you do? So that could be your mini CX. Or alternatively, you need to perform full physical examination. Okay. And mini CX, CBD, long case usually is one-to-one lah. It will be dedicated time. You will be alone with your specialist. But mini CX can be done bedside. Okay, means out of blue moon, tiba-tiba you punya specialist cakap, you have been here for quite some times kan, and I'm your supervisor, so let's do your short case or mini CX. Please perform a full neurological examination for this stroke patient. Okay, so during work round, all eyes on you. That could be your mini CX. Okay, so remember, your assessment could be done anytime for mini CX. Okay, the one you will need to approach is usually CBD. Okay, and mini CX if you haven't done it. Okay. Okay, Azima Sabira asks, can I know who can sign? I will perform CPP and COAP, and what procedure or test that requires our supervisor assessment. Okay, so usually in terms of procedure, anyone who observe you do that procedures can sign the logbook. Or for example, you buat blood taking kan, so you can ask your medical officer who in charge in your ward to sign the procedure for you. Okay, so untuk COAP, compulsory or observe or assist, if you do lumbar puncture, if you do chest tube, this is quite rare, so it is a good practice for you directly after you observe or assist, straight away ask the signature from your MO which has assist you doing that procedure. Okay, so which procedure or test that require your supervisor assessment is the case-based discussion or mini CX. Usually, case-based discussion and mini CX should be done by specialists, or in some department, they give a registrar or very senior medical officer to do the CBD or mini CX instead. Okay. Okay. A last action plan for houseman. Okay, so this is bonus for you all. This is the excellent HO planner which Medicorp designed to help house officer to plan their posting accordingly. Okay, so here's few QR code for you to learn how to use this planner. List of compulsory topics. Okay, when you scan it, it will direct you to the list of compulsory topic for every department, and also a pre-tag checklist. Okay, so pre-tag is basically you go and have a look at your ward before your actual tagging starts. Okay, this will help you to orientate yourself to the department. Okay, so what I recommend you to ask around before you start or during your early days in your new posting is, first, you need to know your tagging or your off-tag requirement. Okay, so you need to know what are the common assessment, common question that will be asked during your off tech, so that you can be ready or you can study those diseases or topics. Okay. So you should put your report duty date here, put your expected to finish date here. Okay. So depending on whether you have 1, 2 or 3 CBD, so you need to put the date that you want to approach your specialist. This is the deadline. So if you have 3, so first assessment should be passed by, for example, your 6 weeks. Okay, next by your 10 week. Okay, and you need to make sure you approach your specialist much earlier before the assessment or the deadline. Okay. And this is important as well. You need to ask your senior husband what the other requirement to pass department. For example, in pediatric, you will need to pass NRP. Okay. What are the incident of concern to avoid during posting? Usually blood transfusion or near miss. Okay. So certain department might have other additional incident of concern to avoid during posting. For example, you should be very careful with needle prick injury. Okay. And as I've mentioned earlier, what are your supervisor style and common topics or questions? Okay. So that you can learn and you can study earlier what are their apa ni favorite questions are. Okay. So it won't be a surprise for you bila assessment lah. Okay. Okay, Divya Lechmanan asks, hi doctor, is there any assessment to off-tech apart from the logbook? Yes. If you see the logbook, pediatric logbook have a sample of off-tech assessment. But other logbook, I don't think they include the off-tech assessment in the logbook. But usually each department will have their own off-tech form or off-tech questions or off-tech format. Okay, so you will need to ask this requirement or off-tech from your senior houseman. Okay, some department give a list of a procedure for you to complete within the 2 weeks. Some department give set of questions or set of topic you need to master, and you'll be assessed by either MCQ or Viva after 2 weeks to ensure that you are safe to do your independent shift after tagging. Okay, so off-tech assessment are usually different and very based on varies from one department to department lah. Okay, so you need to ask from your senior houseman, preferably before you start tagging lah, because usually bila tagging ni dah sibuk, dah tak sempat, nak susah sikit nak study dan susah sikit nak arrange masa. Okay, so better ask during your pre-tag before your actual tagging start. Okay. So, any more questions? Okay, so Nurul Nadia asks how to join pre-HO course by Medicorp. You can go to our website www.medicorp.ny. We embed the link for our online course and clinical skills workshop at our online store at Medicorp store as well. And I frequently share any promotion or link to register at my Telegram channel as well. Okay, it has been a good 1 hour and 35 minutes. Surprisingly, most of you are still here with me. Thank you. So if there's no any additional question, I thank you for joining this session. Okay, so stay tuned in the comment section. I will randomly pick 3 lucky doctor to receive this book. Okay, I will mention your name in this in the comment section later. Okay, thank you everyone for joining this session tonight. Thank you for all your attention and questions. I hope this session has been beneficial for you to have a better idea on how your assessment will be, what are the common reason of extension. Believe me, it is very doable and it is not impossible to pass your posting with flying colors, but you need to plan it properly And obviously you need to do the needful preparation while waiting. Okay, you will have a lot of helpful seniors, helpful medical officer, and a lot of your specialists are actually very keen to teach, and we will welcome you on board to work together to our medical fraternity. So please use the luxury of time you have during the pandemic to prepare yourself to be a good and competent doctors. I'll see you in the next session, and don't forget our career pathway series this Sunday at 9:30. This week topic will be on medical claim assessor, or what your job opportunity in insurance company. Okay, thank you everyone. All the best. Assalamualaikum and good night.